Good morning, Colonel Rathore.
Good morning, sir.
Yes, I would like to know how many years old you are.
Well, I'm 73 and a half.
All right. So, why did you come to Max Hospital principally?
Well, basically, you see, my wife was having problems, some stomach bile duct stone problems, so we had come for operation to Dr. Divan.
Right.
And in the corridor of operation theatre, by chance, perchance, my daughter happened to meet Dr. Arora because I had come from Bareilly for my knee treatment.
All right.
And the way I was having cruciating pain while walking, I was having problem while sitting and attending to my daily routine.
Okay, you were not able to perform your daily activities.
No.
Finding it tough.
Very tough.
Okay.
And I've been a sportsman, but when suddenly I was feeling as if I'm going to collapse.
Okay.
I stopped going out from my house for walking.
What do you used to play?
Basketball, I've been a cross-country runner, name and sports I've been playing.
Okay. What's your height?
Well, I'm 6'3", 189
Centimeters. 189 centimeters.
centimeters.
That's good.
That is 6 feet 3 inches.
Oh, that's good. Fantastic.
And when first introduction was with him, so I was looking for where to go for.
Right.
And in the first meeting, I got impressed with him, the way he spoke to me, and my daughter and my family members, all together, we decided that if at all I have to undergo the knee replacement, it will be done under the under Dr. Arora and his team.
So you had decided that he is going to be the surgeon, and he had explained you the procedure. What is required?
Yeah, before, I mean, that was per chance, by chance. He happened to be in the OT area.
All right.
For her operation.
You came for her surgery and then you met him. All right. Right.
By chance. It's a God's.
Okay.
While I'm being army officer, I was referred to base hospital in Nara. Now, they were suggesting that you go through one knee only. So I had seen few cases here only.
All right.
And the pain, and one of my nephew is the ortho surgeon in London. He also suggested that, uncle, the pain in both, will you be able to sustain? I said, I will.
Okay.
So he got the number of Dr. Anil Arora from my daughter, and he also spoke. Now, to tell you frankly, my experience is that initially, just before the admission here in the hospital, I was panicky. I had never got admitted in hospital, and no incision even done during my entire life. So, but the way the team of Dr. Anil Arora, all of you, the way you people handled me, and I know till the time I was taken to OT for this thing, right from that phase, and when I came back to ICU and regained my consciousness, pain was cruciating, and good staff in ICU also, they were managing, and over a period of, by evening, I was calmed down.
Okay. So you felt comfortable after the surgery?
I felt comfortable, and things from then on, 14th onwards, improvement started. I was itching to get down from the bed. He said, the gentleman who was looking after, he says, you are not allowed to step down.
Okay.
It is doctor who will
permit you to do that.
We will just not, whatever you may say, your urination problem and everything, we are there to take care of you, but you are not.
Okay, so you were feeling confident that you can get down immediately after the surgery?
Next day.
Next day you were feeling, okay, good.
So on 15th, the dressing was changed by Dr. Srivastava, and he asked the what you call physiotherapist
to mobilize you, to get you out of the bed.
To mobilize you.
Okay, this was 2 days after your bilateral knee replacement.
Yeah, that is on 15th morning.
15th of June.
Yeah, they removed that, what do you call that,
Yes.
Sac.
Sac.
Yes.
And I was taken, that fellow gentleman who was doing therapist, Dr. Muslim gentleman, he was looking at me. I said, I can walk.
Okay.
Please take me down. I want to get down.
So you were eager to get down?
Get down and see circulation. I wanted to test whether am I on my feet.
All right, good.
So 15th I was afternoon shifted to.
So you had a strong will. That's what I would say.
No, strong will came up with your support.
All right.
But I was panicky to start.
But afterwards you were comfortable.
After the evening of 14th evening only, I could feel that I am alive. I asked my daughter, am I in my consciousness? She said, no, you're talking, you are sipping soup and all, you're perfect.
So we had somebody who went into panic, but after surgery, next day he was comfortable.
By evening
you were okay. Good.
So that's one. And when we came to the ward, the caretaking, I'm coming on to one very positive aspect.
Okay.
That is, after this surgery, one is mobile and helpless and all. Attention of total nursing staff, the doctors, the way they handle me. I'm a difficult person, Doctor, let me tell you. But the way you people have handled me by caretaking is the word, wonderful. I was impressed upon. And the emergency services, when called for, they were attending me.
Okay, so your recovery was aided by it.
It was speeded up.
Yeah.
That is one. Secondly, my daughters and my son-in-law and my wife, they were pressing that you will not shave yourself. I said, no, I will not allow the barber to come and shave. The 16th morning, I started shaving myself.
Because you have to maintain your mustache. They are very well carved, you have to see. So if the barber comes and he disturbs the symmetry, it's going to be bad for you. This mustache has been managed for so many years, obviously. So it's good. So you mean to say, on the third day, you were able to...
standing on my feet.
And yes, and you were handling yourself.
Handling myself, and I told them.
Right.
Though I'll keep the lock open, but I'll be doing myself. So they were peeping, they saw me standing. Daddy, she was the one who was, Daddy, what are you doing? This is not correct posture, you will spoil your... I said, I'm feeling very comfortable. And then, of course, the toilets also. I never had used the bedpan.
Okay, that's
Never.
good.
And not even a single time.
Right.
So it's all credit goes to Dr. Anil Arora and his well-qualified team of doctors.
Okay. That's also your willpower that adds on to it. Your willpower is very strong. It is your power also is strong. You are always positive. Good. So how are you now? How many days it has been today?
Well, I've just completed 21 days.
3 weeks.
3 weeks, and I was itching, and every time physiotherapist comes, I tell him that why don't you take me out?
Okay. So you want to move out of the house?
Move out of the house.
Have you walked out of the house?
He is not allowed.
But now you're allowed. You are allowed now. Looking at your movement, since your staples have been taken out, looking at your comfort level, we can allow you to move without support. We will record you right away walking without support. So this thing at the back will not be required anymore. Your walker.
Walker not required.
Yes, we will ask you to walk without it right away.
And stairs climbing also.
We'll allow you.
Gradually.
We will do it. Definitely, yes, from today onwards.
So if you can write down.
We will do everything.
That gentleman is good.
Absolutely, yes, he has to follow whatever he says. But you are a person with a positive attitude who wants to go on the next step. I will tell you, normally what you have achieved in 3 weeks, if other people operate you and other teams manage you, this takes about 6 weeks to 3 months to reach this level. But the most important point here is your willpower. That is a very strong thing.
It's actually both sides. What I understand, the first interaction of the patient with the doctor is very important.
Oh yes.
To build up that confidence in himself, whether his body would be able to sustain this kind of surgery, as well as the confidence in the doctor that he will do good for me. So when we came in here, it was I was counseling him from home. I was saying, are you ready? We did watch a few YouTube clippings, and we were also checking on the net which all other hospitals offer this facility, and who are the doctors and which are the teams. So whatever, it was a coincidence, but Dr. Anil Arora's first interaction was so impressive that probably he decided that moment itself that this is the place, he's the doctor I'm comfortable with. So it's ease on both the sides. The doctor provides that comfort, that confidence which is there in the patient is also comes from the doctor. So yes, family also plays a very important role in terms of all the time, because 24 hours doctor is not there.
For the decision making?
True.
The support around the surgery,
Yeah,
post-operative recovery.
yeah.
It is family plus the patient's willpower.
Yeah.
That's absolutely.
No, I definitely doctors' positive comments, his positive encouragement also makes a lot of difference. We are not qualified people to give our comments, but definitely if a doctor says you're recovering well, it boosts
That
up the
puts up-
morale of the
But when
patient.
I say here, as a kind of compliment to my daughter as well as my wife, that any instructions given by doctors, at times I try to violate, but they'll check. No,
Nothing to do.
Nothing to do. So the implementation of, on ground implementation, they have contributed a lot, my
Okay,
family.
that's
members.
good.
Now, as far as the walking concern and all, I've been a hyperactive person. And with this, all the time I've been brooding over till yesterday night that will I be able to resume my normal activity. So and now with the way Dr. Mehra, when I asked you that have you started removing the clips, you said no, I'm checking the surrounding area whether it is properly healing up and all. I didn't have a feeling that my stitches or
The staples were being taken out.
staples have been taken out. Wonderful. Credit to you, sir. And my salute to Dr. Anil Arora and his team of well-qualified doctors.
Salute for the Colonel. That means a lot. I like to ask her something. How does she feel?
बहुत अच्छा हुआ।
आपको लग रहा है कि इनकी जो ऑपरेशन से पहले स्थिति थी और जो अब है उसमें इम्प्रूवमेंट है?
इम्प्रूवमेंट भी है और लाइफ भी बहुत अच्छी होगी।
अच्छी लग रही है विदिन 3 वीक्स। मैं आपको अश्योर करता हूँ आने वाले टाइम में इट इज गोइंग टू बी मच बेटर। विल यू रिकमेंड दिस सर्जरी टू अदर्स?
I have already done, I am doing it.
All right.
And people in Bareilly, they'll be around me the moment I reach there.
Okay.
Those deserving ones.
Right.
also.
Obviously,
So,
yes.
Not only for anything, it is in the interest of the patient.
Patient, that is going to improve the lifestyle.
Lifestyle nahi, means you are in safe hands.
Yes.
That is-
Longevity in terms of pain management, like people try to prolong the suffering. When you have a solution, why not opt for it?
So knee replacement is a solution to severe pain.
Yes.
You'll recommend.
Now I recommend what I have gone through
No,
myself.
the pain which we used to see on his face, that's gone, and
You see a happy face now.
yes.
You can see his smiling face with the teeth on.
It was painful to see him every time he used to sit. There used to be expression of pain on his face. Every time he will get up, he'll think twice whether I should get up now or can I, delay it for some more
So
time.
now his knees will encourage rather than stop him.
Yeah, I'm sure it will.
They were stopping him earlier to enjoy his life.
Yeah.
So how many years younger do you feel now?
Well, I think 10 to 15 years.
Oh, good. So 15 years lifespan. Right? That's good. So you are going into your 50s now.
Yeah.
Fantastic. Congratulations for the result.
Thank you.
All the best. Thank you very much.
Thank you.
My regards to Dr. Anil Arora and his team of well-qualified doctors.
Thank you very much.
Thanks
A pleasure serving you. Thank you very much.